You ever think about, like, what actually happens when someone goes to detox? We see the movies, right? We hear the stories, but what's the real deal?
Yeah, it's definitely a topic that's got a lot of misconceptions floating around.
For sure. And that's why this deep dive you brought us on is so fascinating. Inpatient detox specifically, trying to like separate the fact from the fiction.
It's a very specific thing. People use the word detox for everything these days.
Right. So before we even get into the nitty gritty, let's just, level set. We're talking about hitting the reset button after using substances. Yeah. But one thing that really surprised me from all the stuff you shared is it's not as easy as just like flushing out toxins.
Exactly, yeah. It's
Yeah.
much more complicated than that because when someone's been using substances for a long time, it actually changes their brain chemistry.
Oh, wow. Okay, so it's not just a matter of willpower then.
No, not at all.
Huh.
It's like, imagine your brain gets so used to having that substance, it kind of forgets how to work properly without it. It becomes dependent.
So your body's physically hooked, basically.
Exactly. And that's where things can get dangerous, right? Quitting cold turkey, for a lot of people, it's not just hard, it can be really risky because your body's basically going into shock.
Which is where this whole inpatient detox thing comes in.
Hmm.
From what I'm gathering from everything you gave me, this is for those situations where quitting on your own is, well, it's not even possible. It's straight up unsafe.
It really is. It's like the highest level of care someone can get when they're first starting out on the road to recovery.
Mm.
And it's not just about keeping them comfy, although that's obviously important. It's about making sure those withdrawal symptoms, which can actually be life-threatening, are managed by medical professionals 24/7.
It's like having a medical safety net while your body's going through this huge, intense readjustment.
Yeah.
There was this one thing in the research you gave me about delirium tremens, the DTs.
Yeah, yeah.
I knew it was serious, but I had no idea that alcohol withdrawal could be that dangerous.
Right. And we're talking about a really severe form of withdrawal. And I mean, years ago, the survival rate, if you got the DTs, it was like scary low.
How low are we talking?
Something like 60%
60. So a 40% chance of.
not making it.
Wow. That's terrifying.
It is. It is. But the good news is, with these specialized inpatient detox programs, the survival rate for DTs, it's gone way, way up. I mean, we're talking over 90% now.
Okay, so that is a huge EE improvement.
It is a huge improvement.
Yeah.
And it shows just how effective this kind of approach can be, especially in those really serious situations.
So, all right, so it's clearly super important, this inpatient detox thing. But, and maybe this is just me, but I would think like being in that kind of controlled environment, almost like a bubble, wouldn't that make it harder to go back to the real world? Like, wouldn't you be more likely to relapse when you're suddenly back in your everyday life with all the triggers and everything?
Oh, totally.
Yeah.
I mean, it's a common worry, right? And it makes sense on the
Yeah.
surface. But that's where it gets really interesting.
Because it's not like, what, they just keep you locked up for a few days and then you're cured?
Right. Like it or not, addiction's a bit more stubborn than that, unfortunately.
So what happens instead? What makes it different?
Well, from what I saw, they don't just throw you in a room and hope for the best. One of the things you sent over talked about how inpatient detox, when done right, it actually can, like, lower the chances of relapse over time.
Really? But how? I think being back in the real world would make it more tempting to fall back into old habits.
And that makes sense, right? You'd think that. But the thing is, it's not just about keeping people away from substances for a bit.
So it's more like, what, building some kind of foundation so they can handle being out there again?
Exactly. It's about giving people the tools and the support to actually build a good, solid foundation for recovery that lasts.
Okay, so how do they do that? What does that even look like?
Well, one of the sources you had broke it down into these 3 phases. Evaluation, then there's stabilization,
Yeah.
and then, get this, the fostering phase.
Fostering.
It's a kind of cool name, right?
Oh.
And each phase, it's like it plays a really important part in getting someone ready for life after detox.
So it's like a whole process.
It is.
All right, so walk us through it. What happens in each of these phases?
So it all starts with a super thorough evaluation.
Makes sense. Figure out what you're dealing with.
Exactly. This is where the medical team, they really get to know the person. Like, we're talking about their medical history, what substance they've been using, how bad the addiction is, any other health problems, everything.
So it's like getting the full picture.
Totally. They figure out the person's needs
Yeah.
so they can tailor the detox to them. You're not just a patient. You're a person. It's important.
I like that. So what about the stabilization phase? That sounds kind of intense.
Yeah, that's where things really get real, I guess you could say, the focus shifts to managing those withdrawal symptoms.
Which, as we've talked about, can be really rough.
Yeah, and we're talking like anxiety, not being able to sleep, feeling sick, your muscles ache, the shakes, and those are just the common ones.
Oh boy.
Yeah. More severe cases, you can even have hallucinations or like seizures. Pretty scary stuff.
That's a lot to deal with. So how do they actually help people get through that part?
This is where medication comes in. A lot.
Is it common to use medication during detox?
You'd be surprised. Nearly 80% of detoxes use medication in some form.
Wow, I had no idea it was that common. Makes sense, though. Like you said, those withdrawal symptoms can get pretty intense.
For sure. And it's not like they're just trying to mask the symptoms or something. Some of these medications, they actually reduce cravings and those awful withdrawal symptoms by, get this, they actually work on the same parts of the brain as the addictive substance.
So it's kind of like leveling the playing field in a way?
Yeah, exactly. Give the person the fighting chance. Like, you can't build a house on a shaky foundation, right? They got to stabilize the body first before even trying to tackle the mental and emotional parts of addiction.
Okay, so then what's the fostering phase all about?
All right, so that's where things get interesting. It's all about laying the groundwork for long-term recovery. We're talking therapy, counseling, support groups. It's where they teach you how to cope, how to spot those relapse triggers, give you tools to use once you're at a detox.
So it's not just about breaking the physical dependence. They're prepping you to stay sober in the real world.
Exactly. Give a man a fish, he eats for a day. Teach a man to fish, he eats for a lifetime.
There you go. I was just thinking about that saying. But let's be real for a sec. Even with all that support, detox isn't some miracle cure, is it?
You're right, it's not. It's a huge step, don't get me wrong, but it's just that, a first step.
Yeah.
One thing that stood out in what you shared was how important it is for people to go into this with realistic expectations. Like, you might think, okay, I'm done with detox, I'm good now. But sadly, it's not that simple.
Because this isn't like the flu or something. Addiction, it's a chronic disease, right? It's not something you just cure and then poof, it's gone.
Exactly. And that's another reason why that fostering phase is so important. People need to realize that recovery, it's a marathon, not a sprint.
I like that.
It's an ongoing process. They're going to need support even after they leave. Therapy, support groups, whatever works for them, just to, stay on track.
Speaking of staying on track, one of the stats that really got me from the stuff you sent over was about relapse rates. Kind of scary, to be honest.
Yeah, it's tough to hear for sure. Unfortunately, relapse, it happens a lot, even after a successful detox.
I think that's something people don't realize. You'd think, okay, you went through detox, especially inpatient, where they're basically with you 24/7, you're good to go, right?
Right.
But the reality is
It's tougher than that.
way tougher. Something like 80% of people relapse at some point in their recovery. That's what the research says.
And those numbers, they're hard, but they're important. That's why with inpatient detox, it's not just about getting clean in that moment, in that controlled setting. It's about making sure people have the tools, the strategies to handle those tough situations, the triggers, and get back on track if they stumble.
So it's almost like they're learning to walk again. Even if they fall down, they'll know how to get back up.
You got it. It's about building resilience.
This has been so helpful. But before we move on, can we talk about all the quick fixes you see advertised everywhere these days? The miracle cures, detox teas, all that stuff that promises to cleanse your body from the inside out.
Sure.
Is any of that legit?
Right. Well, I'm all for a nice cup of herbal tea, but let's be real. If detox tea could actually cure addiction, we wouldn't even be having this conversation.
That's true. Everyone would be sipping their way to sobriety.
Exactly. The truth is, those products, they prey on people wanting a quick fix for something that's honestly a really complex problem, and addiction just doesn't work that way.
Yeah, and the bigger issue is that trying to detox on your own, especially with some substances, can be really dangerous.
Absolutely. Like we talked about before, withdrawing from things like alcohol or benzos, if you're not under medical supervision, it can lead to seizures. And that can be life or death, just not worth the risk.
So bottom line is those DIY detox things might sound tempting, but they're just not as safe. You don't have the support of medical professionals if something goes wrong.
Exactly. And it's not just the physical risks either. When someone tries to detox solo, without dealing with the reasons they started using in the first place, it usually doesn't last. They might get through the physical withdrawal part, but without those tools, the support to work on the root causes, they're likely to end up right back where they started.
It's like putting a Band-Aid on a broken bone. It might cover it up for a little bit, but it's not going to actually fix the problem.
There you go. Perfect analogy. And that brings us right back to that fostering phase of inpatient detox we talked about. It's about giving people the education, the therapy, that support system so they can deal with those root causes, develop those healthier coping strategies.
So it's about giving them the tools to not just survive, but to actually thrive in recovery.
Exactly.
It's like we've been saying, detox is a process. It's not a quick fix. But what I'm wondering is, knowing that relapse is a real possibility, what can someone do to make it more likely they'll stay on track after detox? What can tip the scales in their favor?
Yeah, that's the million-dollar question, isn't it? And the frustrating thing is there's no magic answer that works for everyone,
Right.
but there's research that points to some pretty important factors that can make a big difference.
Okay, like what? Give us some good news here.
Well, one of the biggest ones, and this makes sense, right, is having a good support system.
Yeah.
And I don't just mean family and friends, although they're obviously important.
Sure, sure.
It's about surrounding yourself with people who get it, people who've been there, who understand what addiction and recovery are really like.
People who can offer encouragement, but also, give you a little nudge if you need it.
Exactly. Hold you accountable.
Mhm.
And that's actually where support groups can be amazing.
Yeah, yeah.
They give people that safe space to connect with others who are going through the same thing.
It's like that saying, right? You don't know how strong you are until being strong is the only choice you have. But sometimes you need people around you to help you see that strength. You know what I mean?
Absolutely.
Yeah.
100%.
What about therapy? We touched on that earlier a little bit, but how important is that for long-term recovery?
Therapy is honestly crucial. It's a safe space, a structured environment where you can actually dig into those underlying issues that might have played a part in the addiction. Things like trauma, maybe there's some mental health things going on, or just learning some healthier ways to cope with life.
So it's about more than just stopping the behavior. It's about like rewiring your brain.
Exactly. And that's why therapy can be so effective. It's about learning how to manage those cravings, building a better relationship with yourself.
Like having a personal trainer, but for your mind, getting those mental muscles in shape. This has been a really eye-opening conversation. So as we wrap up here, what's the one thing you want our listeners to take away from all of this?
If there's just one thing, it's that detox. As tough as it is, it's really just the beginning. It's like opening the door to this whole new chapter, this chance to take your life back from addiction. And yeah, the journey might be long, there might be some bumps along the way, but recovery is possible.
That's a powerful message. And you know what? I think that's exactly what someone out there needed to hear today. So to anyone listening who might be struggling, please know you're not alone. There's hope, there's help, and there are people out there, a whole community, ready to support you every step of the way.